I have a question for you. A 63-year-old patient develops severe nausea and vomiting shortly after receiving chemotherapy for colon cancer. He is treated with a drug that blocks serotonin receptors on vagal afferents and in the chemoreceptor trigger zone, rapidly relieving his symptoms. So, which serotonin receptor is the primary target of this medication? You will learn the answer to this question after watching this video. Today, we will be talking about serotonin receptors of the Autacoid Pharmacology. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. There are a lot of types of serotonin receptors. Serotonin receptors are divided into 7 main families. These are 5-HT1, 5-HT2, 5-HT3, 5-HT4, 5-HT5, 5-HT6, and 5-HT7. But in this video, we will mainly focus on 5-HT1, 2, 3, and 4 receptors. By the way, did the colors catch your attention? Yes, because these colors have a meaning, and we will learn all about it shortly. Now, let's start with the 5-HT1 receptor. 5-HT1 receptor is the first and one of the most clinically important serotonin receptor groups. All 5-HT1 receptors are coupled to GI proteins. That means when these receptors are activated, they inhibit adenyl cyclase, decrease intracellular cyclic AMP levels, and generally reduce neural activity. In other words, 5-HT1 receptors are inhibitory receptors. In clinical practice and pharmacology, the most important subtypes are 5-HT1A, 5-HT1B, 5-HT1D, and 5-HT1F. Let's look at them one by one. We will start with 5-HT1A, probably the most important receptor for understanding anxiety and depression. These receptors are found in the raphe nuclei, where they function as autoreceptor, and in brain regions such as the hippocampus and limbic system, where they regulate mood and emotional processing. But what exactly is an autoreceptor? Think of it as the brain's own feedback system. When serotonin levels become too high, 5-HT1A autoreceptors signal serotonin neurons to slow down their firing and release less serotonin. It's the brain's way of preventing excessive neurotransmission. Next are 5-HT1B and 5-HT1D receptors, which are especially important in migraine treatment. Migraine is a neurovascular disorder involving activation of the trigeminal nerve and release of inflammatory neuropeptides, particularly calcitonin GAN-related peptide, or CGRP. These receptors are located on cranial blood vessels and trigeminal nerve endings. When activated, they constrict cranial vessels and inhibit the release of CGRP and other inflammatory mediators, effectively stopping a migraine attack. So, whenever you see a question about the treatment of an acute migraine attack, think 5-HT1B and 5-HT1D receptors. Finally, let's look at 5-HT1F. This receptor also suppresses migraine pain by reducing trigeminal nerve signaling. However, unlike 5-HT1B, it does not cause vasoconstriction. That difference is clinically important because drugs that act via 5-HT1B constrict blood vessels. They are contraindicated in patients with conditions such as coronary artery disease or a history of stroke. For these patients, a selective 5-HT1F agonist offers an effective alternative because it treats migraine without constricting blood vessels. So, are you wondering how to remember the 5-HT1 receptor? It's simple. So, let's set up the equation then. 5-HT1A equals anxiety. 5-HT1B equals blood vessels. 5-HT1F equals free from vasoconstriction. Now, let's move to the second major serotonin receptor family, 5-HT2 receptors. If you remember that 5-HT1 receptors are inhibitory, then think of 5-HT2 receptors as the opposite. 5-HT2 receptors are coupled to the GQ proteins. Activation of GQ stimulates phospholipase C, increases inositol triphosphate and diacylglycerol, and ultimately increases intracellular calcium levels. In clinical practice and pharmacology, the most important subtypes are 5-HT2A and 5-HT2C. Let's look at them one by one. The most clinically important receptor in this family is 5-HT2A. This receptor is widely distributed in the central nervous system, where it plays an important role in perception, cognition, and mood regulation. The classic drug associated with 5-HT2A activation is LSD. LSD acts primarily as a 5-HT2A receptor agonist, producing altered sensory perception, hallucinations, and changes in consciousness. So, when you see hallucinations and psychedelic effects, you think 5-HT2A. But 5-HT2A is also important in psychiatry. Many atypical antipsychotics block 5-HT2A receptors. Why is this important? We will talk about this in later videos. Next is 5-HT2C. This receptor is mainly involved in the regulation of appetite, feeding behavior, and energy balance. Activation of 5-HT2C receptors in the hypothalamus promotes satiety, meaning it makes you feel full. This is why drugs that stimulate this receptor can reduce appetite. A selective 5-HT2C agonist that was developed as an anti-obesity medication. Finally, 5-HT2C activation is associated with decreased appetite. So, are you wondering how to remember the 5-HT2 receptor? It's simple. So, let's set up the equation then. 5-HT2A equals altered perception. 5-HT2C equals control calories. Now, let's move to one of the most clinically important serotonin receptors, 5-HT3 receptors. This receptor is special because it breaks the rule. Unlike almost every other serotonin receptor, 5-HT3 is not a G-protein coupled receptor. It's the only receptor that is a ligand-gated ion channel. When serotonin binds to the 5-HT3 receptor, it opens a cation channel, allowing ions such as sodium and potassium to flow across the membrane, producing rapid neuronal excitation. Where is 5-HT3 receptor found? The most clinically important locations are 1. The gastrointestinal tract, 2. Vagal afferent neurons, 3. The chemoreceptor trigger zone. These locations explain its major clinical role, nausea and vomiting. Serotonin, released from in the gastrointestinal tract, activates 5-HT3 receptors on vagal afferent neurons and in the chemoreceptor trigger zone of the brainstem. These signals are transmitted to the vomiting center, ultimately leading to nausea and vomiting. Therefore, 5-HT3 receptor antagonists block this pathway and effectively prevent nausea and vomiting. So, are you wondering how to remember the 5-HT3 receptor? It's simple. So, let's set up the equation then. 5-HT3 equals 3V, vagus, vomiting center pathway, vagal afferents. Now, let's move to the 5-HT4 receptor family. After learning about 5-HT3, which promotes nausea and vomiting, 5-HT4 gives us a completely different clinical picture. While 5-HT3 is the receptor we block to stop vomiting, 5-HT4 is the receptor we activate to increase gastrointestinal motility. The key fact to remember, 5-HT4 receptors are coupled to GS proteins. Activation of GS stimulates adenyl cyclase, increases intracellular cyclic AMP, and enhances cellular activity. 5-HT4 receptors are mainly found in the gastrointestinal tract, especially on enteric neurons and smooth muscle cells. Their main functions are to promote increased intestinal peristalsis and enhanced gastrointestinal motility. Because activation of 5-HT4 increases gastrointestinal movement, drugs that stimulate this receptor can be used to treat constipation. So, are you wondering how to remember the 5-HT4 receptor? It's simple. So, let's set up the equation then. 5-HT4 equals 4 makes food go forward. Let's go back to our question. Patient develops severe nausea and vomiting shortly after receiving chemotherapy for colon cancer. He is treated with a drug that blocks serotonin receptors, rapidly relieving his symptoms. So, which serotonin receptor is the primary target of this medication? The correct answer is the 5-HT3 receptor. Chemotherapy causes enterochromaffin cells in the gastrointestinal tract to release large amounts of serotonin. That serotonin activates 5-HT3 receptors on vagal afferent neurons and in the chemoreceptor trigger zone, sending powerful signals to the vomiting center in the brainstem. And that brings us to the end of today's topic. Now that you have mastered the core functions of serotonin receptors, it's time for today's high-yield challenge. If you are ready, here comes today's question. Which widely prescribed class of antidepressant medications primarily works by inhibiting the reuptake of serotonin into the presynaptic neuron, thereby increasing its concentration in the synaptic cleft? I will be waiting for your answers in the comments. See you later.